Thank you, Mr. Speaker. In the United States, 2.1 million people suffer from dependency and addiction to prescription opioid drugs. 80% of the world's pain pills are consumed in the United States, where we only have 5% of the world's population. This is an epidemic that reaches every corner of our nation, transcending regional, state, community, and neighborhood lines. More people died from drug overdose in 2014 than ever before. Over 60% of those deaths involved the use of an opioid. 78 Americans die every single day from an opioid overdose. There are more people dying from prescription drug overdoses than car accidents. This week, the House is considering 15 bipartisan measures that seek to address some of the widespread problems that have caused and perpetuated this national crisis. But as we look at treatment options and support for those who are dealing with this addiction, it's important that we actually focus on the root cause of the problem. We've seen for decades major pharmaceutical companies have misled the FDA, doctors, and patients about the safety and risks of opioid dependency on commonly prescribed prescription drugs in their efforts to sell more drugs. 3 top executives from Purdue Pharma even pleaded guilty to criminal charges. Just last week, the LA Times revealed how Purdue Pharma has made over $31 billion off of OxyContin, America's best-selling painkiller, by advertising the drug's 12-hour pain relief. Investigations have found that in many people, the drug actually doesn't last for 12 hours. In fact, it wears off hours earlier for most people. This often leads to, quote, excruciating symptoms of withdrawal, including an intense craving for the drug, end of quote. Despite multiple complaints from doctors, sales representatives, and independent research showing that many patients don't experience this 12-hour pain relief, the company has continued to market the drug's 12-hour relief and even are encouraging doctors to prescribe stronger doses when patients complain about its shortened effects. According to the National Survey on Drug Use and Health, more than 7 million Americans have abused OxyContin. Many abusers then turn to heroin, which is made from the same poppy plant and has the same effect. After people are addicted to opioid prescription drugs, they turn to heroin when they can't get their hands on those pills. To give you some context, one 60-milligram pill costs on average around $60. To get the very same amount of heroin, you'll pay 1/10 of the price. The problems created by companies like Purdue are felt deeply by families all across the country. It's happening to our police officers, to teachers, to nurses, and others in our community who all share the same story. They used to take prescription drugs, but now they inject heroin. In my home state of Hawaii, the rate of pain medicine abuse is more than 10% above the national average. According to Hawaii State Department of Health data, deaths from opioid-related deaths have increased 133% from 2000 to 2016. Veterans, people who've served our country in uniform, have been disproportionately impacted by this epidemic. I've heard from some of my friends and fellow veterans how during their visits to the VA seeking treatment, even after telling their doctor, I don't want drugs, they receive prescriptions for those drugs. Up until recently, the VA prescribed opioids almost exclusively to veterans experiencing chronic pain. Prescriptions for opiates spiked 270% over 12 years, according to a 2013 analysis by the Center for Investigative Reporting. This led to addictions and a fatal overdose amongst veterans at a rate twice the national average. Now, the VA is beginning to start to change some of its practices, offering alternative modes of treatment, but even so, that change is not comprehensive. It's not happening everywhere across the country. A national health crisis of this magnitude requires leadership, commitment, resolve, and partnership at every level of government, within our medical community, and within our community itself. I urge my colleagues in joining me to call for further action that holds pharmaceutical accountable, who are profiting off of America's addiction problem, and that holds doctors accountable, who are irresponsibly overprescribing these addictive drugs, and focus instead on finding real solutions that can truly help people. I urge the U.S. Surgeon General to make combating opioid abuse the 2016 call to action, a yearly initiative that helps to stimulate nationwide action to solve a major public health program in the U.S. In the past few years, the national call to action has addressed exercise in walkable communities, skin cancer prevention, breastfeeding, deep vein thrombosis, and underage drinking. With 78 Americans dying every single day from opioid overdose, this is an issue that demands our national attention and action.